You may have been told by your dentist that you need a bone graft. This may have been right after you got a tooth removed, or this may have been right before you got a dental implant placed. So you may be wondering, what is a bone graft and why do I need additional bone inside of my mouth? Hi, I'm Dr. William Park with Bless Smile and Smile on You Dentistry. I'm here to go over what bone grafting is, what the procedure involves, and why it may have been recommended for you. All of our natural teeth are held by their roots inside of our jawbone. When we lose a tooth, the removed root leaves a big hole or a big socket inside of our jawbone. Without this bony support, the surrounding gums, teeth, and bony structures will start to collapse and shrink. If there's too much bone loss, it will be impossible to place the implant in its proper position for proper function and aesthetics. So we must take preventative measures to preserve these natural bony contours and to maintain the surrounding bone as much as possible, especially if a tooth needs to be removed. And even more than that, before we place the final implant, we must make sure that we have enough bone in the area to support that implant. So if the bone grafting procedure is completed at the time of the tooth removal, this generally involves removing the tooth, placing a specialized bone substitute material into that socket, filling that up. A covering is placed over this area to contain the material and to accelerate healing. And then the procedure is concluded by closing up the area by placing some sutures. And then the natural body healing process is allowed to take place. Over time, this bone substitute material will actually be resorbed by your body and will be replaced by your body's natural bone. Once the bone has completely hardened and matured, we can then place the implant and then restore it. It is a similar procedure if it has been a while since you got the tooth removed and you now need to get some bone added before getting the implant. Depending on the amount of bone that is missing, it will change how we do our procedure. If it is a big defected area where we need to build up a lot of bone, we may do the bone grafting procedure, allow the area to heal completely, and then place the implant a few months after that. If it is a small defected area, we may be able to just place the implant and patch those smaller missing areas with the bone grafting material. So I hope that answers some of the questions and concerns that you may have had about bone grafting. If you are interested in finding out whether you are a good candidate for implants and whether you will need bone grafting before that implant, make sure to reach out to your dental professional. If you're in the Orange County area, we would love to have you come in for a consultation or to go over any of your dental concerns. You can find us at smileonyudentistry.com. Thank you for watching.